My name is THEMBI ARRIES. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kobecha. We are back again with an interesting topic. Some of you may be hearing about this for the very first time. And the topic will be on polycythemia, which means more blood than you're supposed to have at a given point. So welcome to the show.
Hi viewers, welcome to Dr. Alternative Show. We are back again. I myself will be asking questions and we will get some interested answers to that.
For the purposes of putting you up to speed with where we are in terms of what polycythemia is, I have prepared this clip for you. Please take a look.
Blood is a very important fluid in our bodies. It carries oxygen, which is our source of life. Every human being has to have between 4 and 5 liters of blood circulating non-stop throughout the body. The main pump is the heart, with a smaller pump called endothelium within the vessels. All this works perfectly until something disturbs the process. One of such disturbances is polycythemia, which means more blood than 5.5 liters at a given point. This is a serious condition which may result to heart attacks, stroke, or sudden death. The most scary part is that it is not easy to detect it, and it can affect all ages.
As you can see, blood is determined naturally by God how much volumes each of us are supposed to have at a given point. You must not have less, and you must not have more. But today we're going to be looking at when you've got more. But when you've got less, there are implications which may even get serious. And when you've got more, there are also implications which may get quite serious. So today, therefore, we are talking about polycythemia. You know, when people come to see me, those people that have been to see me, and who've got polycythemia, they will tell you that I actually can tell if they've taken the COVID vax or not. I know this is a touchy subject, even though the COVID is way back, it's history. But the repercussions are still running. And I'm not thumb-sucking what I'm saying, I'm basing it on the consistency of polycythemia that I detect in some of the people that have taken COVID vaccine. Like I say, you walk in, I scan you, and I ask you, have you taken the COVID vax? This is not the question that I ask everybody. I ask those people where I pick up polycythemia because they have more blood, and in some cases it's actually quite sticky. It causes a whole lot of things because when you've got that blood, it will coagulate. It will thicken in certain areas. There are people that you find get seizures because it's stuck. It's actually accumulating in the carotids, which are these arteries that go to the brain. There are people who have heart attacks, as you have seen the clip. Lots of people that have had sudden deaths or strokes or heart attacks because of polycythemia, okay, because of too much blood, and that ends up causing the blockage. So therefore, I'm not talking about something that I have Googled. I'm not talking about something that I've Googled. I'm talking about something that is first-hand experience because I deal with such people from my caseload that I work with. But as usual, because of the vastness of the topic, we normally try to put structure on it. As usual, Lorica is going to be asking questions around the topic.
Okay, thank you, THEMBI. This is quite a concern, and by the look of it, it is a scare because it can take any age. How does it link to the kidneys?
Okay, firstly, as the clip has alluded to where the kidneys fit onto the equation. For us to make blood, there are certain systems that are involved. It's not just your bone marrow, because the bone marrow, that's where the blood is made. Okay? But your renal system has got a part to play. Your digestive system has got a part to play, besides your bone marrow. Okay. The bone marrow, that's where the red blood cells, there are other blood cells that are made, but now we're talking about the red blood cells which make blood. But for those red blood cells to be made, the message comes from the hormone that is made in the kidneys, the EPO hormone. The abbreviation is EPO. EPO hormone that is made in the kidneys. It sends the message, we need blood. When there are issues with the kidneys, whatever the issues, because remember, you may have issues with the kidneys and it may manifest differently from me, but the source may be the kidneys.
Yes.
You may find in my case, it makes me make more blood. In your case, it makes you make less blood. In what way? The hormone, I produce too much of EPO hormone, and you produce too little of EPO hormone. Therefore, and that affects your blood production. Okay. So the kidneys, therefore, that's the messenger. That's the origin of the message. The brain sends the message to the kidney and say, we need blood. So the kidney sends the EPO hormone to the bone marrow to say, hey, make blood. Okay. So when there are issues, therefore, with your kidney, you might find you may have issues with the kidneys, but it may not tamper with your EPO production. But when you have problems with polycythemia, you must look. And this is what happens also with me. Once a person says, no, I did not, because there are two major areas where I know why you're having polycythemia. If you haven't taken the vax, then you've got there are kidney issues. Yeah. So that's what I've found to be the twin that always leads or that mostly leads to polycythemia. It's not the only one, there are others, but these two are mostly there. But where there is also another polycythemia, which is polycythemia vera. Polycythemia vera is cancerous. It's actually a cancer part of the polycythemia. But secondary polycythemia, which is the one we're talking about today, is not cancer. Okay. But it's overproduction of the red blood cells. So that's where kidneys come in, therefore. That's where the message originates from. It's from that hormone. But also people that have got digestive issues, particularly people that have got the AMAC, autoimmune metaplastic atrophic gastritis. We will also do a show on that. Then you find that their intrinsic factor, which is produced in the parietal cells, which are affected when you've got this condition. Then you find the intrinsic factor becomes low. Therefore, it affects the absorption of vitamin B12. Vitamin B12 is another very important component of production of red blood cells in the bone marrow. Okay. So, but now bringing back to the topic of today, polycythemia and the connection to the kidneys is because of EPO, a hormone which is produced in the kidneys to make red blood cells in the bone marrow. Okay.
Okay. Thank you so much. In the previous episode, we were talking about kidney failure. For those people who are on dialysis, how do they get other functions like hormone production?
Yeah, it's in fact, that's what maybe some people don't understand. That when you go for dialysis is purification of the blood, which is just one function. It purifies the blood and it helps with the balancing of your electrolytes. So when you've got kidney failure, therefore, kidney failure does not just mean the inability to urinate.
Okay.
There are people who go to dialysis but who do urinate on their own, because people have got a misunderstanding that, okay, if your urine is blocked, then it means then you go for dialysis. They don't know that when you may have your urine output, but it's just water. You're leaving all the build-up of your electrolytes. You're not sifting, that all that stuff that you're supposed to filter, it remains behind. So you're sitting with all the build-up that, therefore, the dialysis helps in purifying,
Okay.
It's just like, if I may make an example that connects to our lives, that if you look at amasi, that is sour milk, not the ones that is sold in the supermarkets. That's not amasi. That I'm talking about amasi, natural, the one that comes from milking the cow. That when that milk ferments and forms amasi, you'll find that the thick part of amasi and the watery part, they actually separate. So and in Xhosa, those that are Xhosas, we call intloya. So intloya, it's watery. But in Ngaka, that's the one that you can even chew on because it's thick. So that's what is amasi, not what is sold. In fact, I think the Gen Zs don't even know what real masi looks like. I'm sure they don't. Seriously. And I don't think they would even taste it. They would even eat it because the taste is totally different from what is sold in the supermarkets. So your kidneys, therefore, when they fail, you might find that the filtering is like that thick part that remains behind. So it's just useless water that you are eliminating, which is why, therefore, that you need to go for dialysis to have purification. Now, coming back to your question. So when you go for dialysis, there are only few functions that are covered there, like purification of your blood, electrolytes, helping with those electrolytes. But when it comes to hormones, dialysis does not provide that. Those EPOs, it doesn't mean just because you've dialyzed, then you are sorted. So meaning those functions are not taken care of. Of course, there are certain supplements, like for instance, I was just discussing with someone and we were talking about breathing exercises. She was asking me, which breathing? Because this one says breathe in and hold, and others say breathe out and hold. So she's saying, which one is more effective? Because there's so much information that comes to that. I'm bringing the breathing because it connects to the kidneys also, and even to this EPO. So the breathing that actually I use even in people that check in with us, it's the breathing where you hold after the breathing out. Okay. You remember you go breathe in and hold, breathe out and hold. But the breathing where, because most people do breathe in breathe out, breathe in, and then, so when they breathe in, they hold, they count whatever minutes they can manage. That is not the most effective one in my school of thoughts, okay? The one that is most effective in shooting that brain with oxygen is the one where you hold after you have breathed out. And that's most difficult. Breathe in and hold is very easy. But try breathe out and hold and see what happens, because now you're gasping for air. When you're holding while you're gasping for air, so it's not easy at all. That's the one that is the most effective, which I usually recommend to people that have got kidney failure, because it helps with the EPO production. Because remember, that EPO that you can still assist in producing it. It doesn't mean if we are dialyzing, then that's at least that hormone, the body has got a way of making up. But that's when you are short of it because you've got a kidney failure. Not when you've got more, but you can still try and balance it. So now when you are short of it, you are actually triggering, because remember, the body panics, the brain panics. We've got the sympathetic nervous system, the fight or flight. That's a system that protects you from anything that's harmful to the body. So that is why you will have physiological reactions and you want to run or you want to fight. There are certain changes that occur. And one of those is also, that has got to do with also oxygen. So now, because remember, when you panic, you will, the breathing changes, and what happens is when you are, the body is pumping that oxygen, is filling up your muscles because it's preparing you to either run or fight. Okay. So all those things are not by accident. They are systematic, and they have been created by God so that they make this body to react and to respond accordingly. So even with EPO, therefore, with oxygen, when you are pumping, or not when you are pumping, when you are depriving your body with oxygen through breathe out and hold, then the influx of EPO, it rises like crazy. And when it rises, the message to the kidneys, hey, we need blood, it actually improves. So that is all connected, and it's not by mistake. So so that's coming back to your question as to when your kidneys have failed. So what happens to those other functions that are not taken care of? Some can be assisted, like I'm talking about the EPO, for instance. There are certain things that can be, you can receive supplements and what have you, and only maybe leave certain functions that can only be done. Even the blood purification. I mean, I do treat people that you find that they are on stage 4, stage 5, and you find it gets better. It gets better because we are assisting that. But purification is not only done by the kidneys. We've got protocols where we give you where we purify the blood. I mean, people who are clients, they know we've got systems where clients purify the blood, where we drain the water. Those people that are retaining water, we've got those. So in a way. And you'll find that people that belong to us who are on dialysis, you will find that the first thing you will notice with them, they look different. In what way? People that are dialyzing, you find the complexion, they get very dark. They look, you can just see, you can see this person is not his or her natural complexion. They just look dark because of all the accumulation of the toxins, in their bloodstream. But because we have got protocols, you find our people, the energy levels are different Because also when it comes to stuff like their adrenal insufficiency, which becomes an issue when you've got kidney problems, we take care of that. I mean, I remember one gentleman from Grahamstown, he said, and when he came to us, he was already on stage 5 and he was dialyzing. But now something that he said, which he said he noticed for the first time, was that he did not go with his own transport. He was fetched. I think I don't know if it's the Kumbi that collects them. So, and he said they would drop him at the gate when he comes from, and he said it would be a struggle to walk from the gate to the house, such that they would, whenever he's arriving, the children would have to come and help, walk. But he said with the thing that happened ever since he started with our treatment, he was shocked. And everybody was shocked because they see him walking in and
Nobody's helping.
Yeah, nobody had been called to come and help. Because he said the energy levels, I cannot believe where they're coming from. That it's like I've just been pumped with adrenaline, because we've got protocols that take care of those hormones that you actually run from. So it doesn't mean when you are there, that's it. No, not at all.
Okay. Is there any telltale for this condition that may make a person to seek help before it's too late?
You see, the problem with polycythemia is that it becomes the cause, but then if you look at the diversity of symptoms that come from that condition, it's actually very difficult to go to it and find it as a culprit. I mean, most people, you find a person might say, I tend to have dizziness. Okay, I tend to faint. Like, for instance, the one that I just saw last month in Joburg. I was telling her she gets seizures. Okay, because the accumulation was in her carotids. So I tell her that she gets seizures at night because those the accumulation, when it's in the carotids, it affects temporal lobes. Temporal lobes, you'll find temporal lobe epilepsy happens at night. It's very rare that you'll find people who will have seizures during the day. They're fine during the day and at night, and in most cases you find a person is sleeping alone. So he's not aware that anything happens to them while they're in their sleep. I've even advised those that are staying alone that I know there's an app. I've never looked at that app, but I know there was an app that was advertised which you can use while you're sleeping. It records your activity during your sleep. Okay. So therefore I was saying, if you put this, you get this app and put it on when you are sleeping, you'll be able to see that you actually get seizures at night, because when you sleep alone, you don't know. You may wake up, you find most people will say, like this one was saying, the tendency is when I wake up, I always have a headache, a serious headache, and I don't know where it's from, So I'm particularly with her because she's taking a blood pressure medication, and she checks the blood pressure, she finds it's fine, but the headaches are just there because you get seizures at night. Okay. Others, you find that they will say, I feel like I'm getting a nightmare, and then they, so that's when the accumulation is in the carotids and it ends up causing you to have seizures. Doesn't mean everybody who gets seizures is because of polycythemia. Like I've said, that the diversity of symptoms in the bodies are scary because the body, they can be so many similarities because of the sharing of certain functions. So if you tend to have dizzy spells or headaches, and also it also depends on where the accumulation, because remember, you get issues where the blood is accumulating and coagulating, thickening. If and this is the thing that the other person asked. because she was trying to wrap around what it means to have more blood, you know? And I'm like, just think of a circuit, you know, of a circuit where you flowing, where you put in some water and then it flows. It flows. Now the quantities of this circuit, maybe supposed to say take 10 liters of water, but now you've got 11 liters. So where is this extra liter going to come? Because the space for a free flow is just for 10 liters. Now here you put 1 more liter. Now it's a problem because now there's no space. It's like push this blood is pushing against each other and saying, no, you're supposed to be this quantity, you're supposed to be this. But then where it tends to be pushed and gets stuck, because remember with the flow, and remember the blood flow is a circuit, it's flowing all the time. It may slow down a bit in terms of speed when you're sleeping or when you're inactive or whatever, and then when you start running, then you find it's faster. But it's still flowing around the same circle. Unless you end up having a fistula, where it may break off and then flow to another, follow another route, you know. But that's still the same cardiovascular system. That creates a problem of a different kind in another area. But it's the circuit. It's the circuit. So therefore, when you've got more than the capacity of the circuit, then that blood is going to be squashed somewhere where it gets coagulates, because if then it's flowing and then the speed of the heart slows down to a point where when it gets to your leg, for instance, the speed is already very low. Then you get coagulation in your leg. Then your leg feels, it's numb, it's tingly, or it's whatever. Okay. So that's what therefore happens, that if the circuit and when the heart slows down in the speed and then it ends up dumping somewhere, coagulation is going to occur in that particular area where the speed. So depending on where it is stuck, you're going to have issues in that are consistent with where the issues are. Let's go for a break. When we come back, we continue with the discussion.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to ARRIES enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
We are talking about polycythemia, a condition where you sit with more blood than your cardiovascular system is meant to accommodate. And that ends up creating problems of different kinds. When we went for a break, I was touching on the different symptoms that may indicate that there are issues of this nature. But like I was saying, that the problem with polycythemia is that where it is a serious, it's actually a silent killer. If, for instance, you take these young people, you find they are sports people. Those are the people that are mostly at risk. And most of those people have actually been forced to take the vax. Okay, so you don't take the vax, you don't play. So you find that maybe a person, these sports people, they are the ones that are mostly active. So the blood speed is always pushed to the limit. And if you push your blood flow to the limit while you've got less space for that, that's where it hits them harder. Whereas those that are less active, you find maybe, they are just as exposed, but the risk is a bit less because that heart, because it's running at a slower speed, it can at least negotiate that, okay. Whereas with the speed, there's no talk. It's just running. So that's why you find, therefore, with them, the risk is quite substantial. A person may have had maybe sharp pain, but remember, they've got doctors. These sports people have got doctors that are assigned to them. So they will check and they will not find nothing. Because it's not like you will get this and maybe you will have a thing, but like I'm saying, that it's a silent killer. Because even if they see that your heart is a bit out of and maybe your blood pressure is a bit elevated, they will attribute that to something. And maybe it's slow, they say rest a bit and then they give you whatever. They don't know that the production is just ongoing. So when it gets to a point, then it will just psh, and that's it. So that's the problem with it, that even though there are a few telltales that people can follow, like I'm saying, you wake up, you've got headaches, you get dizzy, sometimes people find when the sole of the feet gets sore, it's like there are some bumps, under the feet, or it becomes tingly, so you'll have a range of symptoms that don't necessarily point to polycythemia, that may point to heart, that may point to kidney, that may point to digestive system, that may point to your bone marrow. Symptoms where you find if you look there, they're just going to look there. So that's really the scary part of polycythemia, which concerns me not because of polycythemia per se, but because of how conventional is actually shortchanging itself by the way they have dissected the systems. I promise you, this is something that I get horror watching every day in my line of work. Every day, I promise you. I don't know at what stage we will be able to talk, because it's scary. It really is scary. So even with polycythemia, you sit, it's just a time bomb. It's just a time bomb. Because they won't be able to see that you've got polycythemia until they go and look there. It may be dancing around all over. They won't see unless they go and knock at the door where it's supposed to be coming from. Meanwhile, and by the time they do that, it's too late. So that's the frustration I have, which I leave to God to facilitate. Because it's not like I'm not doing anything on my part. I am, but I'm banging closed ego doors. Ego. It's ego that is blocking them from exploring the possibilities, But anyway, if you come to me, I'll tell you if you've got polycythemia, and I'll save you from the catastrophe.
Thank you. Yeah, in your experience of dealing with people with this condition, how do you treat them?
This is one thing that always concerns people. Whenever I detect that they've got this, and I said, we've got to get that blood out. Okay. And there is a procedure which is called phlebotomy. Now, phlebotomists are people who make you bleed out. Okay. Even in hospitals, when you go to hospitals, you'll find that people that are used now mostly to draw blood, because some nurses, this is something that I noticed recently. Yeah. When I was taking someone to have the albumin test done. And this person, so when they were drawing the blood, they used, it was not an ordinary nurse like it used to be in the past. It was a phlebotomist. I was like, oh, wow, interesting. Because the phlebotomist specializes in dealing with bloodletting, how to draw, how to get that vein, because some people have got veins where they end up giving up because they can't find the vein. They prick you, they remove, they prick, The phlebotomists are people who are actually meant to be good at that, to be experts in that. So I advise people to go for phlebotomists. But most people have realized this particular person made me laugh so much. She had this condition. So I advise her to see if in her area there are no phlebotomists. And then the way she was asking, that they must draw blood, and I was thinking, the way she was asking, she actually sounded like it was suspicious. She was kind of suspicious. And when I was thinking, what could be making this person suspicious? And I was thinking, oh, maybe, because remember, people, they with all these evil things that are occurring, then you hear that people are drawing blood or whatever. The way she was asking, and I was like, then because we were talking on the phone, and I was like, maybe also because I'm not an ordinary doctor, So I'm this medical intuitive, and some people are still wrapping their heads around, what really am I? So now here I am, maybe she's questioning, what am I? And I'm a medical intuitive. What is a medical intuitive? Of course, she was not asking me. I was just analyzing how she was toiling with this whole idea in the mind. Or maybe, because now, how do I manage to detect all these things? Through this scan. So now with this scan, now I'm saying she must go to a phlebotomist. Maybe it's my counterpart. And I cannot believe the way I laughed afterwards when I was thinking, because she never actually came back to say I must treat her or whatever. I think that advice of saying, go to a phlebotomist, being a medical intuitive, was enough to say, she's saying it's sending you to these satanic things or rituals or whatever. So, it's just occurring now as we are talking about it. But anyway, coming back to the serious note, phlebotomist, that's actually there is a diploma that people can take to become phlebotomists, but all that they do, it's bloodletting. But when you look at how it used to be done, you must not think this phlebotomy is something this comes way back. If you trace the history of medicine or health, you'll find that there were people who were good at just letting blood, because those people had the natural wisdom of dealing with situations where, particularly if maybe a person has got an abscess or maybe a hematoma or that is, blood, that then they would punch. They know how to punch, because you can't just do it anyhow. So there were people who knew how to do phlebotomy, who were phlebotomists. So even now, therefore, I say to people, just find out if there's no phlebotomist in your area, who you can go to. But like I said, this one that I advised. But I also encourage people to do blood donation. But most people, you find it's older people who never did it before, can't start in their 70s, to do blood donation. But besides that, I treat. I treat in what way? Remember, when blood has coagulated, we've got anticoagulants. Okay, but when it comes to too much blood without coagulating, we've got stuff that drains, because remember, blood is largely water. More than 60% of blood is actually water. So when you are having an accumulation of that, then we'll give you stuff that's actually going to drain the fluids, reduce the fluids, like we would in a case who's got edema, for instance, who has got swelling because they are retaining fluids. So the same treatment that drains the fluid build-up would be also part of the treatment for dealing with polycythemia. But there's also a whole lot of other things that we look at, because you find, depending on where the coagulation, the accumulation is actually occurring, then you'll find the physiological interference that has occurred in that area. Then we deal with it as such. Okay, so we've got protocols that deal with polycythemia, but it's always easier when you have got a phlebotomist that also does the bloodletting. Some even do it from the forehead, where you find they will prick. They know which blood vessel to prick, and it will go psss. Then they know when to stop, because remember, this is their specialty, so they know how to do it. But as far as whether we can fix if it's your polycythemia is linked to COVID vaccine, we can't take out that vax, okay? But if it is linked to maybe issues with your kidneys, or whatever may have tampered with your bone marrow or whatever, then we deal with those successfully, even reverse it. But when it's linked to your vax, it's just going to be some kind of a chronic monitoring of your blood volumes and trying to lower them.
So, why do people faint when they just donated blood, while others are fine? Is it actually safe to donate blood?
Yeah, yes and no. It depends on your state of health. Yeah, and also you must also remember that the blood that you donate doesn't mean all these donations are good. That's why they always do the test before they test you. So it may not be safe for you, and it may not be safe for the recipient. But at least these days now they are more careful. In the past, particularly during the time of HIV, a lot of people that got HIV infection because of blood donation. Okay, so but now they do quite a bit of screening. So it's whether it's safe or not depends on your state of health at that given point in time. But it's a philanthropic act to give blood, because you save lives. Okay, you save lives, seriously. But now, why do some people faint? Now, remember, when you're donating blood, it's it's not a drip and drip of bleeding. It's like pumping, that's a quick influx, or quick chunk of blood coming from your cardiovascular system. So, but now what does that mean? Remember, blood carries oxygen, and there are a lot of other things, your hormones, your food, So now when you lose it quickly, because of that quick pumping, your oxygen drops. Yeah, your oxygen drops, which is what will make you to faint. Okay, which is what will make you to faint. But then what happens, even like I was talking earlier, that with kidneys, because they produce that EPO hormone, which gives the quick message to the blood to say we want. Now, when your oxygen drops, because you have taken blood, you become dizzy. Now, what happens is that with your breathing. Breathing is one first thing. That's why you find when people have fainted, or they say, breathe, remove the clothes, give her space so that she can breathe, because that replenishes your oxygen. So even though the technique of just, giving you air does not really give you quickly, but the technique of breathing, particularly if you do the one that I'm talking about of holding without, but you can't do when you've just fainted. When you've fainted, you fainted. There's no instruction. But the fainting itself, you will find that it actually kind of controls your breathing, because you'll find some people, when they've just had a fainting or even a seizure, they on their own. It's like the brain saying, breathe quickly, even though they are not conscious. But you'll find others will quiet. It's like you think that's why people will like to think. Because in a way, if you look at that, when you're not breathing, you're holding the breath, but when you get it, you're pulling quite a bit of it when you take it in like that. So it's all natural. No one teaches you how to do it. You're doing it instinctively, and you are following the needs of your body to get that oxygen. And when you get that influx of oxygen, then the EPO also rushes to say, make blood. So the way God has created us, when you analyze, and it's fascinating, because it's one area where you see, other than in nature itself, because even if you look at nature itself, you can just see God's hand in it, you can just see God's hand in it. So even in our bodies, how we operate, how we function, how the body functions, it's just God's hand. It's not some professor. It's not professori who has put all these things together. It's God who has put this body together in such a complicated way. So that professor is the student, just like we are. That everybody is a student. So this is one thing that I keep telling people, that guys, there is no scientist, no professor who has created the body. This is God's, this is God's creation, and you can see that it fries the brain, how everything works together. And even when we treat you, we're not treating you, the body is treating you. All we do, we equip the body. We give, okay, you need this to be able to do that function. You need this to be able to do that function. But wait, not one person is doing the function inside the body. People still open their eyes like this. Oh, no, it's not your doctor. It's not me who's healing you. Me, it's just that I know. So this is where you're sitting with coagulation. So I give you something that's going to help you to decongest that accumulation of blood. So it's we are just God's piece. Wow. So I want to end with that we are God's creation. Every system that you see in the body is made by God, is controlled by God. God has just given us the wisdom to be able to know where to tap and what to do in order to fix that. So don't be confused and think it is a bunch of practitioners that are actually healing you. It is your body that is healing itself, but we are the people that are the equippers. We equip the body, and we get taught by that very body ourselves. So I hope it's not making you confused more than it is making you understand that we're a piece of God's handiwork. Yeah, so I hope this has clarified you. So now you know, if you happen to have, if you've taken the vax, for instance, if you've taken the COVID vax and you're not sure if you've got this condition, please come to me. I will be able to tell you if there are issues. But if you also have some problems where you tend to have bruising, you did not bump on anything, but now you notice you've got a bruise, discoloration, or you find you get stiff sometimes, or you feel sore or tingly or headaches or dizziness. If you have got some of those symptoms and you don't know where they're coming from, you know where to reach us so that we can test and see how we can help you. Thank you for watching and goodbye.
Thank you, viewers. I hope we did bring clarity. Actually, THEMBI did bring clarity to the questions. And as I said last week, don't hesitate to make your bookings for the Doctor Alternative. Thank you so much.